All right, good evening, everybody, and welcome to another webinar hosted by the Greenwich Hospital Medical Library. My name is Veronica Belenkin, and I'm the Consumer Health Librarian at Greenwich Hospital. Tonight's topic is prostate health updates, and the reason for this is because September is actually Prostate Cancer Awareness Month. We will be having a focus on prostate cancer evaluation, prevention, and the screening, the processes for which to get screened. I am very fortunate to be joined tonight by Dr. Will Josie. He is a resident physician here at Greenwich Hospital. And while you cannot see his face, unfortunately, he will be here to answer any questions you may have and provide his medical expertise through his lovely voice. Thank you so much, Dr. Josie, for joining me tonight.
No worries. Evening, everybody. Sorry you can't see me. I'm having some technical issues, but hopefully you can still hear me okay.
Yeah, rest assured that his advice will still be just as sound. Yep. So before we get started, I just want to emphasize again that this session is recorded, and there will be some interactive portions in this webinar where I will be asking a question to the audience. That is what the slide title will be. And feel free to answer in the chat. I think engagement helps you remember the material better, and it lets myself and my guest speaker know what your basic knowledge is of the topic that we will be discussing tonight. So
yeah, please use the Q&A function, not the chat.
Oh, I'm sorry. Thank you. Yeah, so as you can see in the dashboard on your Zoom, there is a little box that says Q&A. That is where you may reply or add an answer to the question to the audience that I will be posing. And then we will be having a Q&A at the end, but I will also ask that you fill out a brief survey at the very end. It will just take a minute just to let us know how we did and what can we improve for future webinars. So without further ado, I will go into our introductions because I think it helps to know who you are listening to and why you should be listening. So my name is Veronica Belenkin, as I stated. I'm the Consumer Health Librarian at Greenwich Hospital. The best way to sum up what I do is with the slogan, I do not know, but I can find out. Because while I am not clinically trained, as my guest speaker is, I did attend Queens College and have a master's in library science because I'm able to evaluate, share, and organize information. And in this case, it is health information for this particular profession. So as you can see, I also possess consumer health certification from Medical Library Association because I help basically with any kind of health-related literature searches, whether it be about if you have a question about a medication, an upcoming surgery, or you're not fully understanding the diagnosis that your healthcare provider gave you, you can reach out to me and I can look through print resources that I have, the internet, and be able to give you the best up-to-date and most accurate knowledge that I can find. I do this because one, I would like people of the Greenwich community to be better informed patients in order to make better healthcare decisions for themselves, and because I am a Greenwich resident myself and I really do care about this community. So that is my raison d'etre. And now Dr. Josie will just briefly introduce himself.
Yeah, good evening. Thanks, Veronica. Again, sorry everybody that you can't see me. This is the best picture that I can find of myself. My name is Dr. Will Josie. I am from the United Kingdom originally. That's where I grew up and where I went to medical school. I went to Newcastle University Medical School where I did my Bachelor's of Medicine and Surgery. And then while I was there, I also did a master's degree by research in stem cell medicine, which was focusing actually specifically on prostate stem cell research. After graduating from University of Newcastle, I moved to Edinburgh, Scotland, where I practiced medicine for 2 years with the NHS, during which time I did, in fact, do some work with the urology unit as a physician there. And then after meeting my wife, who is American, I moved to the States a couple of years ago and have just started my residency. Oh, sorry. I'll speak a little louder. I just started my residency in internal medicine here at Greenwich Hospital about 9 months ago. So I just moved to Greenwich, and that picture there is me just after moving to Greenwich and my dog having her first dip in the Atlantic Ocean. So it's very nice to be here.
It's a great picture. Yeah, it's much more interesting than mine was. So, this with regards to your stem cell and regenerative medicine masters, could you tell us a little bit more about that and what that could mean for the future of that kind of topic?
So yeah, it was a master's degree in it was split between cancer research and stem cell medicine, specifically looking at trying to identify if we could find prostate stem cells within prostates themselves. A lot of tissues have stem cells identified, which is cells that can produce more cell progeny within a tissue, but they've never been at that point. They'd never been fully characterized within prostate. So we were looking at see if we could identify these cells. The idea being that a lot of cancer cells become cancerous by activating genes originally found in stem cells, and the hope being that if you can identify a prostate stem cell and investigate it further, you might discover ways with which prostate cancers develop and identify new ways of treating those. So that's the long-term outlook from that. We didn't get quite that far in the short time that I was with them, but it certainly was very interesting.
Yeah, it's certainly fascinating, and if the results do come through on it, this could change, this entire PowerPoint and future research in general. So that's really fascinating.
And perhaps in the long run.
So we will move forward with a brief overview of what we will be discussing tonight, just so you all are aware. We already did our introductions, but our next slide will be on why prostate health is important, followed by the early prevention for prostate cancer, as well as overview provided by Dr. Jowsey of the screening processes for prostate cancer that are currently available. I am also offering, for both the benefit of our audience tonight and for us guest speakers and speaker, is a 5-minute intermission or Zoom break. I'm sure everybody could use a break for the restroom or for a drink or whatever. That is for your time to use. And then the other half of the tonight's presentation is going to be just me going over the online information resources for you to do your own research for prostate screening. I have a few book recommendations, and we also have a little bit about health scams and supplements that you should be aware of. And the very final thing is a Q&A. So if there is a question that you would like to pose to Dr. Jowsey or myself, that is the time for you to do it. Just a note to please save those questions for the end of the presentation. And in the same place that you would ask questions during the interactive portion is the same place that we ask those questions in the Q&A box in your Zoom dashboard. And speaking of questions and interactions, I mentioned earlier that there will be an engagement interactive portions of this presentation. That is what is happening now. You will have your first question for the audience, and you can answer in the Zoom Q&A feature. I know it says chat there. That was a mistake. So the question that I'm posing for you that you can take the next minute to answer in the Zoom Q&A feature is, where is the prostate and what does it do? And specifically, where is the prostate located in the human body? And what is its function within the human body? So feel free to answer in the Q&A. I would like to get to know people's knowledge firsthand, because we're going to be going into detail about it in the next slide. So as you can see, this is where you would answer the Q&A portion. So Dr. Jowsey, I don't know if you should answer this because you already know this technically. You are an expert in this. So we're going to leave it to the audience to do it.
I'll hold on.
Yep, so just in the next minute, if anybody wants to forward an answer, nobody's going to be knowing who answered, so you don't have to worry about it being incorrect. This is just an interactive portion for us to know what you already know. And for those, and it might be interesting because as somebody who is not male, that might not come to mind exactly where it is, but it would be surprising for many people that even if you are male, you might not know this, and that's okay. That is what today's presentation is for. So we will continue, I think. I don't see anybody answering, and that's fine. That is what we're here for. So we're just gonna move along. And here it is, right in the picture. You can see right away. It is a gland located below a man's bladder, and it is part of the male reproductive system. And the primary function of the prostate is to produce seminal fluid, which is obviously very important. Dr. Jowsey, you want to take it away from here regarding why prostate health is important?
Sure. So yeah, a lot of people don't know where a prostate is and what it does, which is actually very reasonable because largely it doesn't really do a huge amount, to be honest. As you can see, it's just there. It's present only in men, just below the neck of the bladder. And it sits between the bladder and the urethra, which is the tube through which you urinate. The main thing that the prostate does is it produces proteins and some of the fluid that is incorporated into semen. It doesn't make sperm cells themselves. Those are produced by the testicles. It only makes proteins and fluid that form part of the seminal fluid. So that's literally its only function. It provides a small amount of structural support to the neck of the bladder, but that is about it. So for something which is such a significant, health topic, it really doesn't do a huge amount. In terms of health concerns with the prostate, largely it's not a concern until men start to get a little bit older. The most common problem people experience with the prostate is something called benign prostatic enlargement, which is written there. It's basically just what it says. It's just over time, the prostate tends to grow larger with age. It's not a malignant process. There's no cancer development there. It's just the prostate getting slowly bigger. Initially, that doesn't usually cause problems, and for most men, it will not cause issues. But sometimes, as that little gland gets bigger, it starts to compress the opening where the bladder passes into the penis, and you can get some issues passing urine, and maybe sometimes problems with dribbling after passing urine and things like that. That's the main health concern with the prostate. It's not so much a serious problem, but it is certainly something that can be very irritating and can have significant effects on your lifestyle and your comfort. So it's something it's very heavily focused on with men's health. Beyond just benign enlargement, there are a couple of other less common prostate problems which tend to occur over time, especially as people have enlarged prostates. One is called prostatitis, which is inflammation of the prostate, and the other is obviously prostate cancer, which is a malignant enlargement within the prostate. So those are basically the main three. They're not by and large the only, but they're the ones that most people will be familiar with.
Yeah, and it seems like it would be very easy to confuse those three. But what exactly, if you could go into just a brief detail, what exactly about the prostate makes it grow enlarged as men get older? And is it just it's part of the biology and there's no way to prevent it?
Yes, it's just a natural thing that happens in men as we get older. The prostate, so unlike women, men don't go through sort of a form of menopause. We continue to produce testosterone even as we get older, although not as in as larger quantities. And the prostate as an organ is very sensitive to testosterone, and the division of its cells and its growth are stimulated by testosterone. So as you live longer, your prostate is exposed to more testosterone over time, and it will slowly start to grow. Again, it's a very, very gradual process. It's not something that is naturally prevented, and it's something that will happen in all men. But whether or not it becomes significant to the point where it causes symptoms is more variable. So it's a natural thing. It's not something to worry about. It's just something to be aware of.
Exactly. It's that awareness that is key. And speaking of symptoms, next slide, early prevention for prostate cancer. As many people will no doubt know, because it is drilled into us whenever we attend any kind of health thing, Eating healthily, limiting smoking or drinking alcohol, and maintaining a healthy weight all can reduce the risk of cancer development. But as Dr. Josie will point out to us multiple times in this PowerPoint, the most effective prevention for prostate cancer is to discuss any of those symptoms, any new symptoms early with your healthcare provider. And perhaps Dr. Josie can jump in and just go over these quickly with us.
Yeah, of course. So like you said, Veronica, general lifestyle changes are effective in reducing the development of all kinds, or almost all kinds of cancer. For prostate cancer specifically, there is nothing specific that is generally recommended that will reduce your risk of developing cancer, apart from making those lifestyle changes and lowering your risk of cancer overall. The main thing is to be aware of the symptoms of prostate cancer which can occur. And if you do notice these symptoms, it's important to, not sit on them, bring them up to your healthcare provider, even if you're not sure, just so that they can ask you more questions and do a thorough evaluation. If there's nothing to worry about, there's nothing to worry about. But it's always good just to be aware of what you might experience and whether or not it might be appropriate to discuss them with your doctor. So the most common symptoms of prostate cancer or enlargement of the prostate is usually urinary symptoms. So if you find that you're having to go to the bathroom more frequently, especially during the night is the most common time. If you're finding that your stream of urine is not quite as strong as it used to be, or maybe you're having problems stopping and starting, or perhaps after you finish urinating, you get a bit of dribbling afterwards, that's also can be a sign of enlargement of the prostate. Other signs which tend to be a little more alarming and people are more likely to go to the doctor about, obviously, if you see blood in your urine or your semen, if you have any burning or stinging, and a painful ejaculation is also more uncommon, but can be a sign that you're having problems with your prostate. These signs here are all general symptoms for prostate problems. They're not all specific to prostate cancer itself, but they're certainly something that warrants being evaluated. So those are generally the most common ones. But the main thing to take away is that if you're concerned or you want to know more about your prostate health, is to discuss it with your provider as early as you can, because having those discussions early and getting any relevant tests done early is the best way to prevent anything more serious from developing. Is the main thing to think about.
Yeah, I would hate to be the unfortunate person who experiences all these symptoms at once. But
yeah, luckily that doesn't happen very often.
Yeah, I was just about to ask, if it's just a frequent urge to urinate, especially at night, is that really worth going to the doctor for, or would it have to be like one or more of these?
So I would say that, especially the first two, as men get older, like I said, prostates will get larger and they will start to, it's possible they'll start to interrupt the flow of urine. I would say that even though they probably are related to just a benign problem, it's always worth having that discussion, even if it's just one of these things. If you find that you're getting up in the night to pass urine very frequently, that doesn't by any means mean that you have prostate cancer, but it might mean that you have a little bit of enlargement of the prostate. And even if it means that you have the discussion with your doctor and there's no sign of cancer, it doesn't mean that there's not something that can be done to help mediate those symptoms. So have the discussion, get the all clear, and then you can have that discussion when hopefully your provider will be able to help improve those symptoms. So even if it's just one and you're only mildly concerned, it's worth having that discussion about.
Yeah. So just to get that discussion going, that's a great way to put it. Yep. And now we actually have another different, but slightly different, but same question for the audience. This is a little bit different. This is known as a Slido. For those of you who have a phone on you, you are actually able to scan the QR code on the left and be able to actually answer this multiple choice question. The question being, at what age should prostate screening begin? There's definitely one specific answer to this. You don't have to write it out as in the previous one. If you would rather type it in the Zoom Q&A feature, please do so. Or you can scan in the QR in the QR code, or you can join by typing in slido.com and putting in that code that's underneath it. So it's that I would like people to know what people would say about it. Oh, okay. All right. So while we have one participant so far, at what age should prostate screening begin? 50. Okay. That's one potential answer. Anybody else in the audience want to give it a try? Again, like I said, that we're not going to be grading you at the end of this. This is just for us to know what exactly people already know. So, like I said, it might be a little bit difficult to scan at first, but if you do scan on your phone, I find that's the easiest way because it'll just take you directly to the site where you can answer the question. Let's see. So, oh, looks like we have somebody else who participated. Looks like we're tied between 50 and it depends. Okay. Give it another few seconds, see if anybody else wants to join into the poll. We have 50, 30, 40, and it depends. Oh, okay. Third one says it depends. Okay. Now, I wonder what it would depend on. And luckily, we're going to be discussing that in the next slide. Thank you for those who answered, because those who answered it depends are correct. There is as we're going to be going in the next slide, there is a specific recommended age range made by the U.S. Preventative Task Force. They recommended in 2018 that men who are 55 to 69 years old should make individual decisions about being screened for prostate cancer. But there is the reason that I put down it depends is because those who should consider getting screened earlier than the recommended ages are African Americans and those who have a family history of prostate cancer. Dr. Josie, would you like to go into more detail about this, these considerations?
Yeah, of course. So it's a tricky question because for things like breast cancer, there's a very clear cutoff at which we say, you know, this is once you hit a certain age, this is where you should really be getting yearly scans to look for early signs of breast cancer. With prostate cancer, it's not quite as simple. There's not a real recommended point where we say this is when you should be getting regularly screened for prostate cancer. But like you said, Veronica, once you're over the age of 55, that's when we start thinking that the screening is something to have a discussion about. If you are under the age of 55, so particularly like you said, 40 to 45, that's the kind of age range where if you have a significant risk factor for prostate cancer, it might be worth considering getting screened at that point because if you have a higher risk of prostate cancer, we'd want to detect it earlier if it is there. The reason I say might and you want to have a discussion rather than you definitely should get screened is that screening for prostate cancer is not always recommended in all men, even men with symptoms. Which we can go into actually when we talk about the screening methods. So what the general advice is, if you are between the ages of 55 and 70 and you are experiencing symptoms or you are worried about your risk of prostate cancer, that's the age that really you should be thinking about having a discussion with your healthcare provider. And if you are African American, or if you have a close relative or even a distant relative with a history of prostate cancer, that little age range can be earlier. So it's but the important thing is that you shouldn't feel like just because you're under the age of 55 with no risk factors, don't feel like you can't have that discussion with your healthcare provider. You should always still go and talk to them about it if you have concerns. Okay. But I think on the next slide we have some explanation about prostate cancer screening, about why it may not be appropriate to get screened at certain times.
Yes, and just to emphasis for the audience, it does not, unlike for women, you do not have to get this screening annually, especially if you have not presented any symptoms, correct?
That's right. Yeah, there's no point at which we suggest getting regular screenings for the general public unless specifically recommended by a specialist.
And speaking of the screening tests, we have two that we're going to be going over today. Those are the two that are most commonly recommended in this day and age. It is the prostate specific antigen PSA blood test and the DRE, or the digital rectal exam. But those will eventually, based on the results from those, either of those tests, the prostate cancer will itself be diagnosed via a biopsy. And while screening is not necessarily recommended for everyone, that's based on your discussion with the healthcare provider. And I will leave it to Dr. Josie to go over the specifics of these tests.
So the PSA is the test that most people have heard of when screening for prostate cancer. What PSA is, it's basically a protein that is released by the cells that line the surface of the prostate. If you have damage to your prostate, if your prostate's growing larger, or you have inflammation in your prostate, then you get more cell division and you get increased amount of this protein being produced as a byproduct. When someone has cancer in their prostate, a cancer is an area of increased cell growth, and that will elevate the PSA level in your blood. The reason that we don't recommend just using it as a screening test in absolutely everybody is that PSA is very broad protein that will be produced in all kinds of syndromes. If you have, say, recently had a rectal exam, or if you've recently had a UTI or a prostatitis, all of these will cause your PSA to be higher for a short period of time. And there is a risk that if you have this screening test, that it may come back high, and that may prompt further investigations which aren't necessarily warranted. And all of these investigations, like having biopsies done and having scans taken to look at your prostate, aren't necessarily without risk. Which is why we don't recommend just blankly screening everybody, because we don't want to expose people to the unnecessary prostate biopsies and other investigations that they don't have to have. So the way that we do this is, if you feel like you are having symptoms and you have a chat with your doctor, he or she will have a discussion with you about sort of the likelihood based on your symptoms that you may have a prostate cancer developing, and whether or not they feel it's appropriate to do a prostate specific antigen test. And they'll tell you, what might follow on if that result comes back positive, and your chances of maybe developing malignancy if we don't have this test done. And they'll have a discussion with you about whether it's something that you want to move forward and have. It's not a sort of, this is what you have, so you should take this. It's always a discussion, because there's risks and benefits to doing either way. So that's PSA kind of in a nutshell. The digital rectal exam is a more traditional method of screening for prostate cancer. It's basically when your physician or your healthcare provider will basically feel the edge of your prostate, which you can feel through the lining of the rectal wall. It's not the most comfortable test to have done, as most men will know who have had it done, but it's not a painful thing to have done. And what it does, it's basically a clinical assessment of whether your prostate feels normal, whether it feels a normal shape, a normal texture, and whether it's symmetrical or not. People who have enlargement of their prostate, just benign enlargement, will usually have it'll usually feel larger on examination, but it should always be nice and smooth. People who have prostate cancer may have detectable signs on a rectal examination. They may have an uneven prostate. It may feel a different texture. It may have loss of certain features, which you can normally feel. And so it's used as a screening tool, but it is not by any means as sensitive or as accurate as doing a PSA test. It's not something that your provider can do and say for sure you don't have prostate cancer. I've tested your prostate and it's absolutely fine. But it's something that we can use, to provide reassuring information. And obviously, if we do that test and we feel something concerning, then it's a good way of prompting further investigation. But really, the standard for screening test is the prostate specific antigen itself. And like I said, these things might be used together. the prostate examination is a much more immediate test. It can be done in the office when you go and see your healthcare provider, and it can provide some information very quickly. But whether or not your provider chooses to do that or just discuss the options of PSA with you is something that they will talk to you about that. So those are kind of the two tests that we use mostly, but in general, the prostate specific antigen is the one that's most heavily being done.
Is very, very thorough explanations. Thanks so much for that. Is there a particular reason why a doctor, healthcare professional might choose to give you the DRE as opposed to the PSA, or vice versa?
So in general, digital rectal examinations aren't done as much anymore, largely because although they might be helpful in picking up particularly large or unusual masses, like I said, if you choose to do it and you detect nothing, it doesn't necessarily mean there isn't anything there. And so a lot of the times providers will forego doing that because it's uncomfortable and usually err on the side of doing a PSA test. Sometimes it can be useful in diagnosing other prostate conditions. What we mentioned before, the prostatitis, it's a very sensitive test for prostatitis. If you do a digital rectal exam, in that case, the prostate is often very tender and has a very classic feel to it. So it can be useful in diagnosing that in an office setting without having to go forward with any initial blood tests. But on the whole, most clinicians usually forego that and choose the blood test because it's generally better at picking up malignancy than the rectal exam itself. And it's often kinder to the patients as well.
Yeah, I'm sure some people in the audience will probably have a sigh of relief at that, not having to expect the DRE. So with regards to the biopsy, what would be entailing that if, for instance, the result for the PSA comes back high, even with an additional test indicating that?
Yeah, so the prostate biopsy is the next step after a screening test. So if someone's PSA was to come back as elevated, a prostate biopsy is the gold standard and really only appropriate way to fully diagnose prostate cancer. It's usually a test that's done in the office. It's not something you have to stay in hospital for or even be admitted. It's performed by a urologist, and it's usually done just in their office. So it's a small biopsy needle that's passed through the anus into the rectal cavity, and it's usually a short, sharp snap, and they will take several samples from both sides of the prostate to try and sample as much of the area as possible to detect cancer if it's there. It's done under local anesthetic, and like I said, you're able to get up and leave straight away. It's generally very well tolerated. A lot of times you'll be given a portion of antibiotics to help prevent infection before that. But it is associated with obviously a small amount of discomfort, and you can have some bleeding from the back passage, as well as some blood in your semen or your urine for a very brief period afterwards, which can be distressing, but is not something to be concerned about. So, but like I said, in general, we try to defer biopsies until we've had a significant screening test. So it's not something that any provider would immediately jump to.
Mm-hmm. Yeah, that's the important point, is that the biopsy is really sounds like the last resort that a healthcare provider would do, and based on results of the test. So yeah, that should be very well emphasized for people. So we wanted to add this slide in particular into this PowerPoint because we understand how asking about screening for prostate cancer is sometimes it's up to the patient to get that discussion going, but because of the nature of this condition and the symptoms associated with it, it might be hard to know exactly how to approach the topic, especially for men. So there is actually really an interactive simulation provided by the Centers for Disease Control and Prevention. It's called Talk to Nathan About Prostate Cancer. It's literally just a man sitting on a bench, and he's giving you questions that you could potentially ask him, but you can also ask to your healthcare provider if you do not know exactly how to start the conversation. These are the questions that I took from the simulation. You can certainly click on the link yourself later and see for yourself, but These are just some examples. I want to talk about prostate cancer. Should I be concerned? I've heard about the PSA and DRE screening. What are some reasons I should or shouldn't get screened? Basically what we just went over in the last slide, but if you can't think of it yourself, it's just good to have those in mind. You can even write them down on a piece of paper and bring it with you to the office so you don't have to keep it all in mind. I also recommend that the Patient Safety Foundation outlines basically any kind of question that a patient might have to bring to the doctor's office in these 3 ways. What is my main problem? What do I need to do? Why is it so important for me to do this? So instead of remembering all those questions above, you can just come in with just these, but obviously apply it to prostate health. Like, what is my main problem regarding the prostate? What do I need to do about the prostate health? And why is it so important for me to get this done, get screened, for instance? And I also found this really great guide online. The PSA screening decision guide, that's what it's known as. I will just briefly show you what it looks like. For those of you who have the PDF on file of this PowerPoint presentation, it's entirely clickable from there. It goes over exactly what we talked about with regards to what the PSA blood test and the DRE entails, potential risks, benefits, and it has just a complete chart that you can fill out exactly what your risks are, your symptoms, how you feel about the screening, just so you can refer to it. You can fill it out prior to the meeting. You can fill it out during the meeting. It's just very easy to look into, just very easy to fill out. Should provide some form of relief when talking about this stuff. Dr. Josie, do you have anything to add before I move on?
No, I think those are all good questions to ask if you're not quite sure sort of how to open this discussion. And a lot of men do feel, because the symptoms of prostate problems are often very sensitive, and a lot of men will struggle to find a way to approach, their healthcare provider about this sort of thing. And the main thing to understand is that prostate cancer is a very significant issue, as are prostate problems, and a lot of healthcare providers are often very, very keen to open those discussions with you if you're concerned, because it's something that is very easy to investigate, and if it's detected, it's something that's very relatively easy to do something about. So don't feel like it's something that that your healthcare provider is going to dismiss out of hand. And if you are struggling, to think about a way to ask about prostate problems, it's easy enough just to go in and just talk about the symptoms that you have, and your healthcare provider will naturally ask you more questions about it. So as always, if you're concerned, it's always good to go and ask the question, and your doctor or your healthcare provider will know how to take that forward.
Exactly. Starting the discussion is the most important thing. And while it sucks sometimes to have to be the one to initiate it, is definitely sounds like it's worth it in the long run, especially if there's something. Early prevention is the best prevention. So as we spoke about earlier. With one last question for the audience, feel free once again to answer in the Zoom Q&A feature. It's a very quick question. Where do you go to look up health information? We all have our resources. For instance, I have parents who are both in the medical field. So whenever I have a health question, I generally turn to them first, because I have easy access to them, and they clearly have knowledge that I trust. So they're a trusted source for me. For others, it may be a family relative, it may be a neighbor. It could also be, books, it could be the internet, just to get a general sense of what the audience usually uses. Feel free to answer in the Q&A section. As somebody who deals with information all the time, it can definitely be tricky to know exactly where the best information is. And while the internet does provide vast quantities of information, not all of it is good information. In fact, when it comes to healthcare, more often than not, a lot of it can be fraudulent or misleading. or it can be it can get lost. The truth can get lost in a sea of misinformation, as I'm sure people are aware of. That is currently going on with, COVID-19 information. It's a big issue right now. So for those of you who do use the internet, perhaps you could share a website that you refer to in the Q&A. I would love to know what people use as a source of health information. And at some point, maybe I could even be that source for you, but that's up to you, obviously. I enjoy really looking up stuff for people. I just want to be able to help. But so far, we have not received with both this library currently that I currently run, you are able to access both print and digital resources. I myself have a website that I manage that I'll show you in a moment, where you can actually get to all those links that you need that are relevant to the topic tonight. So I think we're going to move forward and go into that topic of online resources for you to do your own research from home, right from the comfort of your own computer screen or your phone. So first we have Medline Plus. It's a great database. You could basically call it the Google for health information. I also like to call it a gateway site, because it is primarily composed of categories for health. And then each page has a list of links to relevant websites about that topic. So for instance, with prostate cancer screening, it'll have links to the following sites, such as the National Cancer Institute, the Urology Care Foundation, the National Institute on Aging, and the Prostate Cancer Foundation. All of these are great sources when it comes to prostate cancer, or just prostate health in general. And you can avoid having to look for hours and hours on Google through billions and billions of searches if you just go straight to these resources. One of those resources that isn't listed on Medline Plus is my website, the Dr. Stephen Mickley Community Health Resource section. It's a mouthful, but I can assure you that it is very comprehensive. I will quickly show you what it looks like here. This is what the page for prostate cancer actually looks like. If you can find it either under the cancer section, it is the first part, or you can look under men's health in general under life stages. As we can see, we go to men's health. So like I said, kind of the same principle as Medline Plus, where it's a gateway sort of site where there are links to all the relevant topics that you might have about men's health, not just about prostate health, but just men's health in general. And we even have our book list on the side here for if you would like to borrow one of these books from the library, you may do so if you contact me. And I do have another reason for showing this website. It's because this current recording that we're doing right now will be posted and available for viewing for those of you who could not make it, or who want to come back and review what we talked about tonight. They will be listed in the webinar recordings tab. So I believe I'm going to be putting this webinar's recording within the next 2 days under the Where to Find series. So you'll look down here and you'll look for prostate health updates. It'll be in this box over here. It's just so that you're aware that if you would like to share this recording with others, the link will be on this page on my website. So the last thing that I wanted to go over is, as I mentioned earlier, the internet can be very diverse place full of diverse sources of information, but when it comes to anything regarding health, a really big part of knowing how to evaluate and being able to know what's fact and what's fiction is being wary of health scams and those kind of fraudulent information. So I took this screenshot directly from the FDA website on consumer updates. Tip-offs, rip-offs, don't fail health fraud scams. These are the 6 tip-offs to help you identify rip-offs. If there is a product that you see, for instance, on TV, late night TV, that's where they like to advertise, supplements like cure-alls, personal success testimonials, quick fixes, all natural cures and treatments, miracle cure. On social media, conspiracy theories can roam free, and you'll be able to see claims like this is a cure our government or big pharma doesn't want you to know about. It's a way to distract consumers, and it's a way for also to be able to make a profit off of the anxiety that some people might feel with regards to, not just prostate health and prostate cancer, but just any type of health condition or ailment. So these 6 tip-offs are helpful for those of you who are searching for information yourself online to be able to avoid that. I also recommend, if you do find a supplement and you're interested in learning more about it, I would recommend going to consumerlab.com. There are independent test reviews of vitamin, mineral, and all herbal supplements. We also have the National Center for Complementary and Integrative Health, because that's what CAM in the title suggests, is complementary or alternative medicine, which is a genuine field on its own in medicine. And there are many ways that can assist what's already given in standard medicine practices. For instance, one of the ways to alleviate symptoms of cancer treatment is to get acupuncture. That is an acceptable form of complementary medicine. So if you'd like to learn more about complementary medicine with regards to prostate health, there is a section for it on this website. And on the National Cancer Institute, a very reputable website, they also have a section on complementary alternative medicine for patients, including those who are undergoing prostate cancer treatment. The FTC consumer information site, they do have a section on miracle health claims, which is helpful with regards to this, kind of the same way that these tip-offs are. And I really recommend, when you get a chance, to take a look at the Anatomy of a Cancer Treatment Scam by the Federal Trade Commission. They have a YouTube playlist of their own. And I think we actually, actually we have time actually. So it's only about a minute. So I'm just gonna play this for you, just so you can get an idea of what to look for when you encounter these kind of scams online.
No, I'm not a doctor, and I don't even play one on TV. I'm actually an actor hired by the Federal Trade Commission to show you why it's best to use a healthy dose of skepticism when you see ads for cancer cures. Scary and cruel as it is, there are companies set up to take advantage of people with cancer, promising cures that aren't proven to work and may even be harmful. If you or someone you care about has cancer, the last thing you need is a scam. What's the first thing you need? To talk to your doctor. He or she can tell you about any risks of the product and how it might affect your ongoing treatment or any medications you might be taking. Next, be skeptical of claims for cancer treatment products that you see on the internet. You'll hear about supposedly hot products like Black Salve, Laetrile, and Esiac-T, and how they can provide relief for your symptoms or even a cure for the disease. Other things to be aware of: the word natural. Now, it doesn't necessarily mean safe and effective. Natural can be harmful and ineffective. One size doesn't fit all. All cancers are different, and no one treatment works for everybody. Even 2 people with the same diagnosis may need different treatments. Now, exactly how do these scams work to earn your trust? They use testimonials. They seem real, but testimonials can be completely fake. I looked like a doctor, right? And those patients you see, often actors paid to endorse the product. They use technical jargon, a lot of it. But scientific talk doesn't guarantee scientific proof. Big words from a medical dictionary are no substitute from the plain facts from your doctor. The bottom line about treatment is, always talk to your doctor. For more information on how to spot phony cancer treatments and supposed cancer cures, visit ftc.gov/curious. You'll also find sources of information that you and your doctor can trust.
All right, so that was a brief overview of what you might expect from a treatment scam. I'm not sure how familiar Dr. Josie is with these scams, or how often a patient might come through his office or or admitting through the hospital about requesting information about the supplements. But I like that the videos, and we've been emphasizing throughout this presentation, that you need to discuss these with your doctor. If you are curious about these supplements or you want to bring it up, you can definitely be, that can definitely be one of the questions you ask when you come in, talking about your symptoms or just about prostate health in general. But yes, discussion with your doctor should be the primary path that you take, as opposed to just listening to what the commercial or what the supplement bottle says, because a lot of the time, like the video said, it can be paid, it can be just trying to get your money. It's preying on that anxiety that you might feel regarding the health condition that you may be worried about. So that's something that I just wanted to go over with. As I might have shown on the website, my website that I told you about, these are the recommended books that I currently possess in the library at the Greenwich Hospital Medical Library. We have 2 just on male sexual health and prostate in general. And then we also have 2 regarding those who already have been diagnosed with prostate cancer, managing prostate cancer and winning the battle against prostate cancer, for those of you who prefer the print as opposed to the internet. And lastly, I just wanted to make people aware that next Tuesday, there is going to be a webinar on prostate cancer screening, treatment, and advances, featuring 3 really great colleagues also working at Greenwich Hospital. I happen to know Gerald Portman. He works at Holly Hill right here in Greenwich. They'll come in and be able to give you more detail on the specific screenings that we just did a brief overview of. So I highly recommend registering for this as well if you're able. It's at 7 p.m. and you can use the QR code down there at the bottom of the flyer, or you can click the link on the right side of the screen to go there and directly register online for it, just so you're aware. And that concludes our presentation. Thank you so much for attending. This is where you are able to answer your questions. And I'm going to go directly to the question that somebody left on here. I think Dr. Jowsey, you should take this one. This is pretty specific. It's regarding the PSA screening. This audience member wants to know the difference between total and free PSA, and also the 4K score. How might that apply to the PSA screening, and how that might help bring a more reliable result?
Okay, sure, no problem. So I can definitely help with the first part of that. So when we refer to total versus free PSA, a lot of molecules in the body don't float around the system freely. They're often bound to proteins such as something we call albumin in order to facilitate transport around the body and to regulate the amount in your system. So when somebody tests you for a PSA, it's not just a single number. They will be able to get a measure of what's called your total PSA and a measure of what's your free PSA. The total PSA refers to all of the PSA that's floating around in your blood, or at least a percentage of it. And then the free PSA refers to the proportion of that which is not bound to any proteins, which is floating around. So people who have, say, nutrient deficient states might have low levels of protein in their blood, and so the amount that's bound, the amount of PSA which is free and the amount which is bound might be affected. The reason that this is used is when your provider or your urologist gets your PSA level back, sometimes that total PSA level which they look at to start with might be sort of in a kind of gray area where it's not convincing as a red flag for malignancy, but it's not also necessarily reassuring. Like we mentioned earlier, we say usually a total PSA of more than 4 is the threshold, but if it's only just over 4 or over 4 but less than 10, sometimes it's useful to look at the free PSA as well, because that might give you more information as to whether or not it's a concerning finding. I believe usually if you have a total PSA in that gray area, sort of between 4 and 10, but your free PSA is still quite high as a percentage of that, that's more reassuring in terms of your risk of prostate cancer. If you have a sort of a total PSA in that gray area, but the percentage of which is free is quite low, that can be more concerning, and it might prompt your provider to recommend getting a biopsy in that situation. In all these cases, there's never an absolute line where we say this is definitely this threshold definitely means cancer, and this threshold definitely does not mean cancer. Nothing in medicine usually works that way, but all of these things are little nudges that can help push sort of the conversation one way or the other. So, but when you get tested for PSA, both of those numbers should come back for your provider to be able to see and take into account. As for the 4K score, I must admit that's something that I'm not hugely familiar with, so I don't want to give you any advice on that. I know it's not something that's as widely used as PSA, but what I can do is I can do some research and provide Veronica with some information for her to disseminate to you in a more digestible form than you might find on the internet. So I'm sorry I can't give you any information about that right now, but I will get some information. I'll ask Veronica to forward it on to you.
Yeah, I was just about to interject and say that, yes, if there's something that we're not aware of and can answer right away, I can definitely be able to look into that for you. We didn't expect somebody to ask something that specific, so that just already shows how knowledgeable our audience is. So that's really great. And we love getting questions like this, because that makes us look into what we already know and also try to gain more knowledge ourselves. So thank you for asking that. Speaking of, I have my contact information right there. So if the person that asked that question wants to send me that, I just need their email in order to send that information about the 4K score to them. So, and then everything else on here. Do we have any other questions from the audience? I know we're a little bit over time, and I don't want to keep Dr. Josie. He's already been such a great sport tonight. If there's any other questions, just ask in the question answer section. But I'll just let everybody know that this is where you can register for more free and upcoming webinars, such as my next webinar with Dr. Michael Foti, Managing Chronic Pain. That's on September 28th. That's next Tuesday at 6 p.m. That I realize now that that's the same day as the prostate one that I just talked about, but it's at a different time. It's 1 hour earlier. So if you can handle 2 webinars in one night, go for it. But I will not be personally hurt. I will not hold a grudge if you decide to attend that webinar instead of mine, but that's just how it ended up happening. We ended up having a webinar on the same date. But for those of you who would want that is on September 28th at 6 p.m. And both of those webinars will be recorded, including this one, and they will be posted on the Stephen Mickley Community Health Resource Section website, link over here. Since I don't see anybody else asking questions, I think we're going to conclude for the night. I just want to ask that people please fill out this survey before they go. I'm not sure if I'm able to post this, the link to this in the chat, but I'm going to try to. So let me just do that. Copy, and then I'll put it in the chat right here. So, okay, so that's not working. You know what? I'm going to email this to all of the people that registered tonight. So I will do that instead. Apologies for that. I wasn't sure why that's not working. But yeah, so thank you so much for everybody that attended. It is 7:05, so we're going to conclude for tonight. Thank you so much, Dr. Josie, for joining us. Great explanations. You clearly know your stuff, and I'm sure you helped a lot of people out tonight.
No worries. Thank you so much, Veronica, and thank you everyone for the opportunity to speak.
Of course, come back anytime. And have a good night, everybody.